All right, the name of the article I selected is The Application of Creatine Supplementation and Medical Rehabilitation. Here are the authors, and the publisher is there. Chose this article because I have a personal interest in the role of creatine in the strength conditioning and health and wellness realm, and sports performance. But this article actually took it another way and basically dove into if it has a role in the clinic and with the populations we'll be working with. So basically, creatine monohydrate has a well-documented anabolic potential. It was first discovered in 1937, I believe, but most of the benefits we know that it has, we discovered in 1990s, which is maintaining lean muscle mass, improving strength, endurance, and power output. Typically, we see this in high-level athletes or the weekend warrior, or just typical gym goers, pickup basketball players. But like I said, this article takes it and checks out its role in the clinic and with certain populations, which we'll get to later. It primarily is involved in the ATP-PC energy system, and that's going to be your short burst, high intensity, short duration events and activities such as American football, baseball, weightlifting, wrestling, the 100-meter sprint, things like that. So chronic and acute conditions can basically result in issues with body systems like the cardiovascular system, your neurological system, your musculoskeletal system. And in older populations, a significant loss in muscle or any of these systems due to those conditions has a huge increase in mortality, and the risk of mortality. So any intervention we can find that's going to focus on regaining muscle in these vulnerable situations when you're dealing with these types of diseases and conditions must be prioritized. And creatine is worth looking into if it could be used as one of those modes of prolonging quality of life and helping these types of populations and patients that we're going to work with in the future. So basically, this group of people looked at 16 clinical trials and formed a comprehensive list of where creatine could be as shown as efficient in some type of use, where it might have some use, and where it absolutely won't have any use, at least from what they read. The efficacy of creatine supplementation during periods of inactivity has also been observed in animals. So they did human research and animals, primarily rodents in this research. So this is the cool picture. This was in their paper with the results. So the role of creatine with these populations, it's going to be likely effective to help them. I thought muscular dystrophy was a cool one because that's going to be associated with a lot of atrophy, a lot of loss of muscle. And if we can sustain some muscle mass in those types of patients in that population, we could prolong quality of life, and better treat those folks. So that'd be awesome. Recovery from exercise, say you have someone who's post-op in your outpatient clinic and they're not super active, maybe if they can recover from bout to bout, they're more likely to adhere to an exercise program and see better outcomes because of that. In the yellow here, they found that the creatine could be possibly effective with these populations. And then, of course, in the red, they didn't find evidence or research to help support the fact that creatine could help with these populations, unfortunately. Now, it's really worth noting that it's a bit of a stretch for a medical doctor in today's world to rush to, have their patients take creatine. That's just not realistic. That's not happening. But it doesn't just need to be creatine. We should be looking at all possible alternatives to opioids and other things, and just anything that can help these types of populations should be worth looking at. So the paper was very open about having to have more research done. And a lot of the research they looked at did support the fact that creatine doesn't help at all. So there was really no agenda here, and they were very transparent, which I respected. So in the clinic, how would we use it? I kind of just touched on that, but basically it does demonstrate promise as a rehabilitative aid. So what have I learned about myself? How did I challenge myself? Basically, I chose this because I'm pretty familiar with creatine's role in an active population, and I wanted to kind of see how it could relate to what we're doing here in physical therapy school and as students and as clinicians, and if there's any benefit in our populations that we're going to be working with. So I thought it was kind of like two worlds colliding, which is really interesting. The next steps in my physical therapy journey, I could go on and on about this, but with the short time I have left, I'd like to try to pursue a sports residency. I lean towards working with orthopedics and sports performance and sports medicine and injury, reducing the risk of injury. There's no such thing as injury prevention, probably, but reducing the risk. I could see myself teaching down the road. I think that'd be really awesome to give back and be a prominent role model for younger people who want to do what we're doing. I think that'd be awesome. Um, in addition to that, I'd like to continue my education through continuing ed by maintaining certifications as a personal trainer, as strength and conditioning coach, maybe try to obtain my SCS and OCS. And yeah, that's pretty much it. Here's my reference.